Scientists are reporting a new version, that Delta Plus. ABC 7 News reporter Luz Pena spoke to infectious disease experts who are studying this variant and are concerned a booster shot of the vaccine might be needed. She joins us live now from the newsroom. Luz.
Yo, what up? It's your boy Rob coming back at you once again with another video. So before we get started, you already know what to do. If you're not subscribed to the channel, hit the bell icon twice, smash the like button, share this video out to all of your followers, and let's get it cracking. All right, I run these videos in Premiere format so that it's easier for you guys to watch them all the way through to the end. So help your boy do that and hit the links at the end of the video. All right, hit the links at the end of the video. This channel is doing amazing with some amazing and unexpected growth. So be a part of it. Hit that bell twice so you're notified, and let's talk about coronavirus because it's Corona time. All right. So U.S. hits 100,000 COVID cases, and that's the highest since before the vaccine rollout. Now, let's ask ourselves a couple questions. We got this new variant called Delta that's out. Could that be why? Could it be because of breakthrough infections? What do you guys think? Let me know. Give me some feedback here, all right? The U.S. has topped 100,000 new COVID-19 cases on Saturday, its highest daily total since before the vaccine rollout, federal data show. This is the highest rate of infections nationwide since the winter wave, which at its peak saw over 250,000 cases per day in January. Cases leveled out in June at just around 11,000 per day, the Associated Press reported. It had taken the U.S. 9 months from the outbreak to reach 100,000 daily cases in November. Hospitalizations and deaths are increasing, but still remain far below the pre-vaccine peak in January, when over 120,000 were hospitalized. More than 44,000 Americans were hospitalized with COVID-19, according to the latest data from the Centers for Disease Control and Prevention. That represents a 40% increase in 1 week and a 400% increase since June, the data show. Nearly 500 people are dying related to the virus a day, according to the weekly averages on Friday. That's up from 270 deaths 2 weeks ago, according to Johns Hopkins University. Deaths peaked at 3,500 per day in January. All right. Cases and hospitalizations have seen the most significant increases in the South, particularly Florida. And if you guys remember, Florida, for whatever reason, has always been a problem area with COVID-19. So in the comments, I need you guys to tell me where you're from and if COVID-19 is a problem in your state. All right. It seems like it's a problem all over the place, but then there's some people that, there's never really any contact with it. So let's try to figure some of these things out through discussion. All right. That averages nearly 20,000 per day, accounting for 20% of the nation's new cases. Florida, Georgia, Alabama, Mississippi, North Carolina, South Carolina, Tennessee, and Kentucky now represent 41% of the nation's new hospitalizations, according to the CDC. So this is interesting. I got a question here. Do we have anybody from Florida, Georgia, Alabama, Mississippi, North Carolina, South Carolina, Tennessee, or Kentucky in here? Holla at your boy. Let me know. All right. Florida's hospitalizations also reached their highest point in the pandemic this week, with more than 12,864 confirmed COVID-19 patients as of Friday. The state's Department of Health and Human Services reported this. That's a daily average of 1,837 hospitalizations per day. Now, I have a question for all of you people who watch this channel who live in one of those states. Have you been to the hospital since the pandemic? And if you have, can you say where you've been, what hospital, and how your wait time was or how the staffing was at that hospital? Type that in to the comments for me. And if you have articles or anything, local news that supports that, help me out with that, okay? Florida Governor Ron DeSantis pledged not to shut down businesses or impose a new mask mandate last week. All right, so this is what DeSantis is doing down there in Florida. All right, predicting that the current spike is a seasonal outbreak and adding that lockdowns have failed time and time again throughout this pandemic. the governor, who has encouraged residents to get the vaccine, has also passed legislation banning local K through 12 districts from requiring masks for students and staff. DeSantis has traded verbal blows with President Joe Biden all week over the handling of the virus. All right. So my question is, what do you guys think about that? What do you guys think about that? Kind of crazy, right? Kind of crazy. Now, here, there is a mandatory vaccine. All right. There's a place called, I think this is Christiana Care. All right. Hundreds protest against mandatory COVID-19 vaccine. All right. So what I find interesting is the government, Joe Biden, I'm not sure, but I believe that he made a promise and said, the vaccine will not be mandatory. But the thing that's interesting that people should pay attention to is that he doesn't have to make it mandatory. Everybody else can make it mandatory. Now what? Now what do we do? Right? My best advice is to start a YouTube channel. Post a video up a week. Hopefully people like your content and they subscribe to it. When you come to that crossroads and you have to make your decision, if your decision isn't something that is conducive to you being able to continue to work where you are, hopefully you've built up a decent following and you can just get a paycheck from Google. That'd be nice. You know what I'm saying? That's some life consultation for you there. All right. You don't have to show your face or anything like that. You know, there's ways of making videos if people are scared, things like that. This is not a country like the CCP, controlled by a tyrant and a dictatorship, protester Helen Ron said. That's interesting, huh? This isn't a country like the CCP, controlled by a tyrant and dictatorship. Well, I might disagree. But because this is Corona Blacklight and not Blacklight Revelations 1 or 2, I talk about that in my other channels. So make sure that you subscribe. Watch this video all the way through to the end, and when the circles come up, hit those so you can see my views on that kind of stuff. Newark, Delaware. So this is going down in Newark, Delaware. Has anybody ever been to Newark, Delaware? I've never been to Delaware at all. If I'm not mistaken, is that where Joe Biden is from? Is he from Delaware? Hundreds of protesters rallied outside of Christiana Care in Newark. Is there anybody here that works for Christiana Care or know anybody that works for Christiana Care? Saturday to push back against the hospital's decision to mandate the COVID-19 vaccine for all employees. So this is a hospital. Yeah, man, the hospitals, they don't play. Usually whatever the CDC says, the hospitals, especially if they want to be a premier hospital or if they want to maintain what's called a magnet status, 9 times out of 10, they try to implement this kind of stuff. Now, my question is, I just mentioned a term called a magnet status or to remain being a teaching hospital. Do you guys know what a magnet status is, or do you guys know what a teaching hospital is? If you do, educate the people that watch this video by typing it into the comments for me, all right? The protesters, some of who are employees of the healthcare system and some who aren't, said that they are fighting for medical liberty. But the hospital says the decision is about safety. We all have the right to the freedom of our bodies and what we put in our bodies, said Adriana Brown, a protester who does not work at the hospital. Protester Helen Ron said, "What I'm thinking, Americans have to stand up. This is not a country like the CCP, controlled by a tyrant and dictatorship." Well, I agree that Americans do have to stand up. I agree with that. However, I disagree with this country is not like the CCP, controlled by a tyrant or a dictatorship. This country is controlled by a tyrant and a dictatorship, and people are just tricked into not understanding exactly how that tyranny and dictatorship works. So we are indeed living under the same system, in my opinion, right? China and America both have yellow fringes on their flags, don't they? When it comes to dealing with the communist or capitalist alleged governments, right? Just saying, if they don't have anything in common, why those fringes on the outside of the flag? Last month, Christiana Care joined nearly 100 healthcare systems across the country in mandating COVID-19 vaccines for all employees. the imminent danger posed by the highly transmissible Delta variant, and remember, we're already dealing with what's called the Lambda variant, has tipped the scales in our effort to balance the right to personal freedom with the right to have a safe workplace, said Dr. Ken Silverstein, the chief physician executive of Christiana Care. Is that Christina? Christiana Care. Christiana Care. We are not standing here as anti-vax. We are standing here against the mandate. No forced compliance to get the vaccine in order to keep your jobs. And I can rock with that. I respect that. How do you guys feel about that? I agree with that. You don't necessarily have to be anti-vax to say, hey, wait a minute, I want control over my body, and whether I do something or not, it's required of my job. It's kind of like blackmail, don't you think? Kind of like extortion a little bit. Little bit extortion, said Tori Mullane, who organized the protest. She is a former patient care tech with the hospital. She says she put in her 2 weeks notice earlier this week in response to the mandate, but was told to leave that day. Oh, I believe it, man. Healthcare is shady, especially when it comes to letting people go. They'll make up something. I kind of would have the power to take that power back from Christiana and leave it on my own terms instead of being terminated. For me, this was the hill I was prepared to die on, she said. The hospital says the vaccine is saving lives. COVID has shown more clearly than ever how we are all interconnected. Vaccination is the best way to protect each other, said Silverstein. The hospital has given employees 6 weeks to comply with the mandate. They have until September 21st to get their first shots. So if you guys know anybody that's affected by this situation, have them reach out to me, provide them with the channel address, all right? And maybe we can get them on a live stream and we can talk to them about this, all right? If I have any subscribers who are healthcare professionals who would like to come on to a live stream and discuss some of this stuff, that would be great, all right? Because we need to talk about this, and we need to talk about it amongst informed Americans. You guys agree with me? Or do you disagree? Let me know, okay? Lambda and Delta Plus sounds like a fraternity mixed with an airline, doesn't it? I told you there's going to have a whole fraternity of coronaviruses. Now, let me ask you a question. At the virus fraternity, Delta Lambda, what's their favorite drink? Corona. See, that's that stupid corny. That's that dumb, like, you dumb. And then, like, you'll giggle about it, like, 3 days later. You know what I'm saying? That's that kind of humor I have. So, you know, everything with me catches up. I'm one of those kind of people, you know, you get in a fight, I'm going to punch you a whole bunch of times. You ain't going to feel it right then, but, you know, you go to the doctor maybe a week later because you're hurting badly. And, you know, you're bleeding internally and have a couple broken ribs because that's how I get down. All right. So now here it says the Delta variant. All right. The Delta variant is fueling the COVID-19 surge in the United States. So remember, we already went over that in this article here. The U.S. hits 100,000 COVID cases. All right. They hit 100,000 COVID cases. And here it says the Delta variant is fueling the COVID-19 surge in the United States. But experts warn that a more dangerous variant could emerge if more Americans don't get vaccinated. Delta is the most recent of 4 coronavirus mutations added to the World Health Organization and Centers for Disease Control and Prevention's variants of concerns list. So we're going to check out that variants of concerns list eventually, okay? Viruses constantly mutate, and most changes aren't concerning. Right now, health officials are most concerned with the spread of the highly contagious Delta, but are monitoring mutations closely. These include Lambda, listed as a variant of interest by WHO, and Delta Plus, a mutation of Delta itself. Okay? Now, here's what Delta Plus is. All right. Delta Plus is where you get the good seats. You know, they're soft. You can put the head back. All right. I think they'll come and offer you drinks and coffee maybe like 3 times on your flight. You know what I mean? Oh, they're talking about viruses. My bad. The Delta Plus variant has an additional mutation in spike, where some people are saying it is resulting in increased transmissibility. So what do we say? Delta Plus, right, is resulting in increased transmissibility. Dr. Nevin Krogan, a University of California, San Francisco, told KGO TV's Luz Pena. Okay, so we might actually want to look at that. Okay, it was one of 18 Delta variant mutations. So Delta mutated 18 times. Did you guys know that? And one of 7 mutations that has a change in the spike protein. So it's one of 7 that has a change in the spike protein. All right. Delta is mutating compared to other viruses incredibly quickly. So this is a key thing with Delta. Delta seems to be mutating highly quickly. It mutates so quickly that it has a new version of itself. I think a big part of that is because there is a significant percentage of people who are getting infected and are asymptomatic. So there is a significant percentage, okay? This is what you need to be careful of, people. However you be careful, whatever method that may be that you use to keep yourself safe, be aware that there is a significant percentage of people who are getting infected and they're asymptomatic, okay? This world is really a huge petri dish. Yeah, that's kind of how life happened, but okay. I mean, I don't know why that guy would need to remind us of that. More data needs to be collected to confirm if this Delta Plus is more transmissible than the Delta variant. All right. Dr. Anthony Fauci, which is very interesting. We got to keep our eyes on that sneaky little fella. Dr. Anthony Fauci, the nation's top infectious disease expert, told Good Morning America Thursday that there is no firm evidence to determine whether the spread of the Delta Plus mutation should be a cause of alarm. Now, that's kind of contrary to what was just said. But then what will happen is Dr. Fauci will be able to keep his job, the news will stay standing, and somehow my YouTube channel will disappear. But I didn't come up with any of this. I'm literally reading what these people said. The Delta variant that we're dealing with is so capable of pushing out other variants that we're not expecting that to take over. Having said that, we follow Delta Plus very closely. All right. Even with a new mutation, the vaccines continue to prove effective against these variants, said Dr. Monica Gandhi, an infectious disease specialist. All right. It's true that it's mutating, but the one thing to remember about the immune system is that when we get protection from the vaccines, you form T cells across 85 parts of the spike protein. Losing 11 to 13 places on the spike protein, you still have very strong T cell immunity from the vaccine, she said. Now, this is Lambda, all right? We got all the fraternity brothers right here. WHO classified Lambda as a variant of interest. All right. In June, meaning its genetic changes could affect transmissibility and disease severity. So this is interesting. We need to watch for new reports of interesting spikes in numbers. This means health officials are watching Lambda, but they're not panicking. Less than 4,000 cases of Lambda were documented worldwide, with a small number detected in California, Texas, and Louisiana. The Lambda variant was first detected in Peru, all right, in December of 2020, according to World Health Organization, and makes up 81% of COVID-19 cases sequenced in the country since April of 2021, according to a June WHO report. It has since spread to other Latin American countries, along with the United States. Despite reports of the Lambda variant, experts at Houston Methodist say Delta is still the primary concern in the United States. So these experts at this hospital here, Houston Methodist, they say that Delta is the primary concern. Lambda is the dominant variant in Peru, and Peru has always had a very difficult time with COVID-19. It shares mutations in common with the alpha variants, the beta variants, the gamma, which is the dominant variant in Brazil. So did you guys even know that there was alpha, beta, and gamma variants? Did you guys know that? Dr. Wesley Long, medical director of diagnostic microbiology at Houston Methodist, told ABC News, "I don't think there's sufficient evidence at this point that we should be more concerned." All right, so this is what this medical expert is saying here. "I don't think that there is sufficient evidence at this point that we should be more concerned about Lambda than Delta. I still think Delta is the primary concern for us. There's a lot more evidence that we have that the Delta is much more contagious. The viral loads are much higher," he added. Okay. "Since the Delta variant is so hyper-contagious, it is likely to prevent Lambda from taking over. The quicker people develop immunity to the virus, the less likely they are for more variants to develop or take hold." All right. So my question for you guys is, what do you think about that? Did you guys even know that there was all of these mutations? Does any of this come as a shock to anyone? That's my question. All right. So this is interesting right here. This is what we have. As Delta variant turns into dominant strain in California, scientists detect Delta Plus. Now, my question is, have you guys heard about Delta Plus in the news? Have you heard about it? Let's hear what this woman, Liz Pena, says. Okay.
Still spreading across the country. Now scientists are reporting a new version, that Delta Plus. ABC 7 News reporter Luz Pena spoke to infectious disease experts who are studying this variant and are concerned a booster shot of the vaccine might be needed. She joins us live now from the newsroom. Luz.
Dion, just to give some perspective as to how fast these variants are mutating. In May, the World Health Organization declared the Delta variant as a variant of concern. Now, fast forward to July, now we have cases of the Delta Plus in the U.S. Accounting for nearly 36% of COVID cases sequenced in June across California is the Delta variant. By now, many have heard of it, but have they heard about its new mutation? Have you heard about the Delta Plus?
No.
Working to stay ahead of these mutations and studying the Delta variant is UCSF's Dr. Nevin Krogan and his team. What's the difference between the Delta and the Delta Plus?
Well, the Delta variant has 18 different mutations. 7 of them are in the spike protein. The Delta Plus variant has an additional mutation in spike, which some people are saying is resulting in increased transmissibility.
Last week, Dr. Krogan met with close to 50 scientists in New York City to understand how the Delta variant is mutating and morphing into new strains like the Delta Plus.
It's mutating compared to other viruses incredibly quickly. And I think a big part of that is because there's a significant percentage of people who get infected that are asymptomatic. So the world's really a huge petri dish.
UCSF's infectious disease specialist Dr. Monica Gandhi says the Delta Plus variant is a vital example of the need for a global vaccination plan. The Delta variant was first detected in India, then it mutated into the Delta Plus, and now is in the U.S.
It looks like the Delta Plus variant has been detected in Utah.
But the vaccine continues to prove effective against these variants.
When we get protection from the vaccines, you form what are called T cells across 85 parts of the spike protein. So losing 11 to 13 places on the spike protein, you still have very strong T cell immunity from the vaccines.
Is there a chance that there will be a need for a booster shot because of the Delta and the Delta Plus variants?
There is a chance of that, like older people. I think it's going to be a decision that the United States makes, and they're likely to emulate the UK and Israel, whether older people and immunosuppressed patients need a third shot.
Now, more data needs to be collected to confirm if the Delta Plus is more transmissible than the Delta variant. What we know now is that the Delta variant is the dominant variant in California. And according to experts, the more unvaccinated people there are, the more places these variants have to continue mutating. In the newsroom, Luz Peña, ABC 7 News.
All right, well, Luz, for those who are maybe not medical experts, do you know if there could possibly be a Delta Plus as this mutation cycle continues?
Yeah, and I did ask that, and yes, according to infectious disease doctors, all these variants, if given the chance, can and will continue to mutate. Normally, we don't really hear about these mutations because the majority don't have an effect on the virus, but some will actually help the virus infect others and mutate even faster. Back to you, Dion.
Boy, something we need to watch very closely going forward, Luz.